I'm Gordon McVie, editor of ecancer. Just to reflect a little bit on the ECHO meeting in Amsterdam. I still call it the ECHO meeting, but it's technically ECC, which is ECHO together with ESMO and ESTRO. 18,000 people came to Amsterdam, and it was an extremely exciting and interesting meeting. Most of the work of the meeting was done in small places. There were a lot of interesting studies and discussions, workshops on radiation biology, frequency of radiation delivery, radiosensitization. A lot of interesting discussions on oncopolicy. I was involved in 2 sessions, one looking at the way that our policy in Europe should develop, especially with the 2020 horizon coming up in front of us. The general idea that was coming out of these meetings was that although the scientists are on track, the patients are not, and we're not talking enough with them. We've selected from our items which we covered, and we covered 40 plus interviews and many news items at the meeting, a handful of important topics which we'd like to share with you. One of them is long-term survival with ipilimumab in melanoma, which is quite remarkable and very reassuring. There are a couple of new drugs which are interesting, one very new and one which is a combination of drugs rather than a single drug. And then there's a really quite remarkable and alarming meta-analysis presented by a PhD student from Rotterdam on diabetics getting more cancer. Professor Stephen Hoddy from Dana-Farber in Boston led an international group of scientists and clinicians who'd been involved in the first trials of the new antibody against CTLA-4 lymphocytes called ipilimumab. We've been excited about the data in melanoma patients, patients who've failed everything else. We've seen response rates varying from 20 to 50, sometimes 60%. We're frustrated by the fact that there's no biomarker yet for ipilimumab. The notion has been, well, where is this new form of immunotherapy, not anti-cancer antibodies, but anti-lymphocyte antibodies? Where's that going to go for the patient? Well, the answer is in a series of 1,800 patients who were involved in a number of clinical trials, plus another 2,500 or so patients who were not in trials but have been followed up carefully, taking us to a total of around 4,800 patients. There is a 9 to 11 months median survival. This we knew from the early studies, but what we didn't know was there was a tail of the curve. And out to around 3 years or so of follow-up, there's a small number, about 1 in 5 melanoma patients, who are still alive and doing well. And there seems to be a very gradual fall off to about 17% at about year 7. And after year 7, there are no late events, no late recurrences, no deaths. So we're talking about 10-year survival, which is a quite remarkable breakthrough for any drug, and particularly an antibody in melanoma. The most exciting new medicine to be reported at the ECC meeting, in my view, was another antibody against PD-L1. This is an antibody which is taking the same approach as ipilimumab. In other words, it's not derived against anything on the cancer cells, but on the lymphocytes, the policeman lymphocytes, which have been suppressed due to the cancer. The rogue policeman, as somebody calls it. And these ipilimumab type molecules and anti-PD-L molecules seem to attack the rogue policeman. Now, we're aware of the data in melanoma where the combination of the 2 targeted agents, CDL4 and PD-L1 antibodies, do seem to produce remarkable responses. But Jean-Charles Soria from Gustave Roussy reported a phase 1 study with remarkable results in non-small cell lung cancer. He found that this new antibody, PD-L308A, was active in 25 or so % of previous smokers with non-small cell lung cancer, which was about double the response rate in non-smokers. This is very exciting because so far the good news about, for instance, the ALK-targeted drugs have been best in non-smokers, whereas, as we know, the epidemic of smoking-induced lung cancer is the big challenge. So a new approach, new hope for smokers who have gone on to develop lung cancer. Very early days, we don't know how this will work, and we don't know how it will combine with other antibodies, but really good start. Trastuzumab has been all the rage for the last 5 or so years in HER2 new positive breast cancer. The problem with it has been that not all HER2 new positive breast cancer patients respond to trastuzumab nor lapatinib. And the second problem is that patients tend to develop resistance. Very important study was reported by Hans-Will Diers at the ECC meeting in Amsterdam, which was a randomized trial of patients with breast cancer which were HER2 new positive, but these patients had failed on trastuzumab and or lapatinib. So what to do with these patients who are frequently in reasonably good condition and want to do more. And the trial was randomizing what the doctor wanted to do with the patient, conventional treatment, such as it is, versus a combination drug, which is trastuzumab plus emtansine. And the result is that survival in these heavily pretreated patients with metastatic breast cancer was doubled from 3 months to 6 months. This is a hard nut to crack for this combination drug, so it's clear that it will be tested up front in trials to come. It's refreshing for grey-haired oncologists like me to see really interesting results coming from a youngster. And Kirsten de Bruin is one such. She's a PhD student at the Erasmus University in Rotterdam, and she has studied with others in a meta-analysis 1.9 million diabetics. And they have looked at the incidence of breast cancer and colorectal cancer and the outcomes of treatment for those two cancer conditions. And they are pointing to a risk which could be maybe 20% or so for these diabetics of getting breast cancer, and maybe a little bit more risk for getting bowel cancer. A little bit alarming, but I think maybe a little bit less tight in terms of the follow-up and the data. It was the notion that the patients who had been were diabetic and then went on to get breast cancer or bowel cancer might fare worse than matched controls. First report, meta-analysis done by the usual rules. We have to be very respectful of it, and this will challenge a lot of people who have been a little bit blasé maybe about the potential link between diabetes and malignant disease.